if you were working with me, you'd say, okay, David, this is our baseline. You're not necessarily scoring me against, or are you, the broader population, or are you really almost scoring myself against myself, and now I've got a baseline, and you're going to show me areas that I can probably improve in. Trying to get a feel for, like, how do you have items of comparison when you were to do an exam on someone like me?
Yeah. So the answer is yes to both.
Okay, perfect.
But let me explain a little bit more.
With this podcast, what we're trying to do is have real, authentic discourse.
Stacy, it's good to have you here today.
Thanks so much for having me.
It's been a pleasure to get to know you with the Center for Brain Health here over the last couple of years.
Thank you.
As you are probably aware, we are doing a podcast. This is our year of inauguration of it. It's called Treatment Redefined. And what we're trying to do is bring thought leaders in around the area of mental health, addiction, brain health, to really challenge the status quo on how people can get better throughout treatment. And I thought having you on today would be great because we share something very much in common. That's a healthy brain.
That's exactly right.
So I thought what we might do is just open it up and maybe just give people a feel just for who you are and your background and what you do for the Center for Brain Health.
Fantastic. Well, thank you so much for having me again. It's a real joy, and it's something that I just relish in talking about. And I know we share lots of common interests here, so it's a pleasure to get to chat. My background actually is in mental health. I'm a licensed professional counselor. I've always had a dual track, however. So in addition to doing more traditional talk therapy, I also have a background in neuropsychology. So I've worked in quite a few different kinds of clinical settings, from young children, doing assessment with them, to older adults. And one thing that drew me to the Center for Brain Health was health, right? So moving a bit from a disease disorder model, while important, to one where we look at everyone has a brain. How can we help support their brain's health, right? So the Center for Brain Health has been around for 25 years. We just celebrated our 25-year anniversary.
Congratulations.
Thank you. It's a fantastic place to work. And so what we do is translational research, looking into the field of cognitive neuroscience. So the center, our founder and director, Dr. Sandy Chapman, is interested in helping anyone with a brain maintain and improve their health. So we do things like look at research in specialized populations, as well as looking at healthy groups. So we might work with folks who may have a mental health disorder and look at how we can support their brain health. But we also look at folks who are high performers. How can we help support them? We also work with folks who are in the military or who are veterans. We work with middle school teachers. We work with basically, again, you have a brain. We would love to help you improve your brain health and performance. So I've been with the Center for Brain Health for 9.5 years now, and have just found so much joy in being able to use some of the more traditional tools, assessment tools, for example, and use them in a way that helps support functional improvements as opposed to just kind of diagnosis and more traditional treatment. So.
No, I love that. I love that. I feel like a lot of what the Center for Brain Health is doing is bringing an analysis to the table that has been used in just overall general health, like where you might go to a certain clinic or a certain doctor to get a complete workup, a physical workup, where they're not really looking at any of the healthiness of the brain per se. But you guys are kind of bringing a similar analysis to the table.
We've called it for a long time. This is Dr. Chapman's phrasing. We've called our assessments a checkup for your neck up, right?
Yes, I love, yes.
And I hear that a lot actually from folks who come for a variety of different programs that we run. Folks will say, I go every year. I am diligent about getting my physical. But it feels like this big black box, right, that doesn't really get assessed when I talk about my brain. At maximum, they'll often get a brief, 5-10 minute cognitive evaluation. When we understand that the brain is so multidimensional, right?
Exactly.
There's so many ways we can support it. So we really hope to, address things like, like we know now we know what we can do to help support the heart, right?
Yes.
It's been a real focus of both research and public education, and that's what we want to do for the brain.
Oh, it's great. It's a good purpose. Okay, so give me a feel for how the Center for Brain Health looks at a healthy brain. What is a healthy brain? I mean, I can imagine some people going in and maybe going through your assessment and almost being a little nervous, wondering, is my brain going to be deemed healthy or not? So how are you looking at this? Are you talking about IQ? Are you talking about other types of variables or different segments that you're looking at as it relates to the brain? Like, what are you looking at to determine what's a healthy brain?
Yes, so you can imagine, at a place called the Center for Brain Health, a bunch of people in a room going back and forth. What is brain health? How do we define brain health, right? Because it's a big question, right? And you talk to different professionals from different lenses, a neurologist versus a psychiatrist versus, someone a neurosurgeon, and they might talk about brain health in different ways. So we broadly define brain health, right? We say that brain health is your ability to thrive in your life context, right? Well, goodness, that might look different for me than it does for you.
Absolutely.
Right? So then it demands a multidimensional approach to assessing brain health, to really evaluating brain health. So your question about IQ tends to be more of a fixed model of cognitive abilities, where we know actually there's so much more that impacts our brain health in addition to how we process more kind of rote cognitive information. How do we actively problem solve?
That's right.
How do we engage with loved ones and have creative relationships? How do we maintain our sense of emotional resilience in the face of stressors? And all of these things impact our brain health. So we really want to kind of widen that lens of what is brain health.
Now, that's really interesting. Before you and I had gotten to know each other and before we really established more of a relationship together with our companies, I had read Dr. Chapman's book, Make Your Brain Smarter.
That's so cool.
And one of the key takeaways that I've just found so interesting, she hits on things like multitasking, and that if you think multitasking is actually means your brain's working well, it's actually working against you. But then she took on the notion of things like, the IQ test or just rote memorization. And she was really looking at, can you synthesize information, lost information, bring it together, synthesize it, and apply it across different platforms. That in her mind, that's really a sign of intelligence.
Right. That's absolutely right. So it's really expanding this notion of what we can do with our brain.
Right.
I mean, to me, it's a very optimistic picture because it really emboldens and empowers each one of us to consider what we do with our brain every day and then how it can impact our health in the long term, as opposed to, as you mentioned, this idea of rote learning, which is very much emphasized and has been historically emphasized in traditional education models, which is also something that we're working to change and working with our adolescent reasoning initiative and working with middle school educators to help them empower their students to think more from a brain healthy standpoint, right? Because we do know that actually not only is that more a hallmark of what I would say having a smart brain, right?
Exactly.
It also positively impacts our brain health over time because it harnesses neuroplasticity.
I think that's a really good point. I've got 3 children, and we talk about education from time to time as they've been growing up. 2 of them are in college. One just graduated. The other one's in high school. But growing up, I was very much into things like athletics and sports, and my education growing up was a good one. Went to a good high school, went to a good college, but it wasn't until I got into law school that I felt like the way you were taught was very, very different than I'd ever experienced. So they call it like the Socratic method, or, put different labels on it. But what it really is there's, when you would take an exam at the end of the year for each class, there wasn't necessarily a right answer. It's how you took the years-long worth of principles and applied them to new fact patterns, and you reasoned through it. And so I felt like for me, and it's probably not for everybody, but for me, that was like the mental health boot camp that I needed in my life to really develop your way of thinking about things.
Yes.
And so I completely agree with how you're approaching this. I feel like it's a little bit of the way they teach students in law school.
Well, I'll say as an aside that I have the opportunity to get to work one-on-one with a lot of different kinds of folks from different walks of life, but I often can tell when I'm working with a lawyer because I do think that there is something particular about the discipline and the particular way in which law is taught that trains the brain in a certain particular way. That's so interesting that you mentioned that. There's certain assessments, and I'm like, this is my lawyer assessment. They're going to do really well on this one.
Yeah, it's interesting because a lot of people think you graduate from law school knowing a lot of law. That's actually not the case. You learn the law once you get out.
Wow.
You actually learn the way of thinking. And I think it's a great approach. I wish it would almost matriculate down into grade schools and high schools.
Completely agree. Because we know that we are living in an information inundated society. So what kind of information should we identify as? Like if we're looking at rote learning, is it X information? Is it Y information?
That's right.
And in 2 years, will that change? But what won't change is our ability to really thoughtfully and in a disciplined way consider information from multiple perspectives. And as you mentioned, generalize it into other settings.
Exactly.
That'll be useful always.
For all,
right?
Yeah, absolutely. Mm-hmm. Okay, so let's dive in just a touch. Tell me about what an evaluation looks like. You know, what are you looking at? How long does it take? How do you score it?
Yes. Oh, goodness. Okay. Well, so as I mentioned, my background is actually in mental health and traditional talk therapy as well as neuropsychology. So, if there are any of your listeners that are neuropsychologists, let me say that many of our measures are standardized measures, right? They're ones that probably many of your listeners would be familiar with. However, there's also a good number of our assessments that we've developed over the last 25 years. Now, they are valid and reliable, but they are ours. And so let me start with that. The core of our assessment in terms of cognition is looking at active information processing, particularly executive functioning skills. So that ability, as you mentioned, to synthesize information, to problem solve, to think flexibly and very fluently about information. And then we look at things like memory and attention as those areas that are designed to support that active information processing, right? So it's going to look different than a traditional IQ test, which I could give in my sleep right now at this point, right? It's really taking it and looking at more abstract thinking that's more problem-solving based. So we can actually, now we have the ability to do that both in person or online.
Do it online.
Right. So the whole, in terms of what that looks like, if it's an in-person assessment, we're talking about 2.5 hours or so. Online takes about an hour and a half. But that's just one piece of what we look at, right? So if we're thinking about that, you could call it clarity of thinking. Okay. That ability to think clearly through information. But as we touched on earlier, what about folks that we know that may not be quote unquote book smart, but are incredibly socially adept, right? Can walk into a room and can have a conversation with anyone that they walk up to, right? So what we also look at are things like connectedness. So this is the sense of connection to people and to purpose. How effectively are you connecting in with the world around you? So the way that we look at that tends to be through unique questionnaires, some of which we've developed, others that are been published and are out there. And then we also look at areas of emotional balance. So this sense of how are you regulating your sense of the stressors around you? Are you interpreting them more from a opportunity and challenge standpoint, or do they feel more heavy, and so they're creating more symptoms related to anxiety or depression, right? So that whole assessment process tends to be very singular. So if it's online, the individual can take it anywhere. In fact, we've got folks all around the world who are taking what we call our brain health index. The in-person assessment happens right now in the Dallas office, right? So in our Dallas Fort Worth location, and it's one-on-one. So we really, this idea too that I think really was profound for me when I started working at the center was I, of course, was trained in giving assessments, but one thing that I think this center does really well is understand that when we help people get their best performance out of them, when we create an environment where folks feel that they don't have to worry if they're going to fail, their brain's going to fail, right? Or they're not going to do well, right? Then we actually see a more robust and also a more authentic performance. We're getting a snapshot of their brain health. And then folks feel more empowered, I think, right? Because I'm able to share with them. That's the other piece, is that once we score this, which, we've got a small but mighty group of folks who who score these assessments, right? And we're looking at abstract thinking. We're looking at novelty. We're looking at the connections they derive, right? The great thing about, and one thing I love about what we do, is that there's always the opportunity to share that feedback with the individual.
Yep.
We don't keep it in a little, box and say, well, and dole it out, right?
Yep,
Where there's nothing about what we do that we don't want to use as an educational tool. It is always about educating and empowering folks. So anything that I'm doing with the individual and assessments, whether it's online or it's in person, I want to then translate that to folks so that they feel like, oh, I understand myself better, I understand my brain better, and I have a few practical steps to be able to move forward to support my brain.
It sounds very personalized. Like I'm listening to you and I'm thinking of like clarity and emotional regulation and novelty, things of that nature are going to be very personal from individual to individual. So when you score this, if you will, are you really looking at it like, now I've got a baseline? Like if you were working with me, you'd say, okay, David, this is our baseline. You're not necessarily scoring me against, or are you, the broader population, or are you really almost scoring myself against myself, and now I've got a baseline, and you're going to show me areas that I can probably improve in? Trying to get a feel for like, how do you have items of comparison when you were to do an exam on someone like me?
Yeah. So the answer is yes to both.
Okay, perfect.
But let me explain a little bit more. I don't want that to feel like I'm just equivocating. So we are able to say, okay, David, like here's how you compare to other people around your age, to your cohort. And I'll say that people are very interested in that, right? And then if you're a high performer, I get a lot of people who are like, okay, but how do I compare to people who are like 20 years younger than me, 10 years younger, right? With a twinkle in their eye, they're asking these things, right? And that's helpful, but it's important to remember that why oftentimes we compare folks to a cohort. It's to rule in or out a problem.
Yeah, I could see that.
Okay, so that's a good starting point, but boy, do we want to take the conversation to the next step, which is exactly as you said, comparing you against you over time.
Got it.
Right? So establishing that baseline, that initial snapshot is so important. And to your point, it is absolutely personalized, because not only is it personalized in terms of your scores, if I tell you, okay, so it looks like, wow, you mentioned you've got a lot of stress right now. It looks like it was hard for you to kind of harness your attention. And you also mentioned your sleep quality's not been good. Well, what if I provide that feedback to you and you're like, yeah, I've got an infant at home. Okay. Well, as a clinician, it would probably be pretty frustrating for me to tell you, oh, well, no, you've got to improve your sleep or your brain health is gonna really suffer. How is that helpful for you right now with an infant? Probably what I'm going to say is it gets better. As a parent, I can tell you it gets better, right?
It does.
But let's look at some other areas that you might be able to move the needle a little bit more effectively and easily right now. And then we'll put sleep and in the parking lot, and we'll come back to it, right? So It is highly personalized, even if I'm looking at the same set of results.
Okay. Yeah. Okay. So I get these personalized results back, and from there, I'm kind of assuming here you give me a game plan.
Yes.
You give me a set of modules, a curriculum. What is it I'm going to be doing? And give me a feel for over what time frame? Like, what's your process for helping me?
Yeah. So we've looked at this. Gosh, so I mentioned we've been involved and incorporated together for 25 years at the Center for Brain Health. And so the way that those for lack of a better word, interventions or training and support has looked. We've looked at this through many different lenses. Right now, for folks who are taking an online assessment, an online brain health index, that is going to be fairly initially prescribed to you. All right. And the reason being that we want to give you our core cognitive tools in training modules so that then you can use that and translate or generalize it out into any other part of your life, right? Okay. So we want to give you these 9 core cognitive principles. They're generally through brief videos, modules, doesn't take longer than 15 minutes a day, right? To fairly regularly check in. We say between 3 and 5 times a week, although we do have some folks who are super users every day, right? Yep. Who are doing this. But our key is not just to take in the information, but to do something with it. So the whole idea is to provide support for you to operationalize this understanding. So you ask, how long does it take? Well, I'll tell you that, especially in our online training, we saw with regular engagement, we saw change in as little as 3 months, right? And by change, I mean from anyone's baseline to improvement in this brain health index, right? Now, the interesting piece is that was not at all impacted by one's gender, age, or level of education. Equal opportunity is available to anyone who engages in these cognitive training modules. So beyond that, we also have modules related to stress and how to best kind of harness stress to make it our friend and not our foe. Sleep and how important and critical sleep is to brain health, as well as things like social interaction, how to think creatively, how to do something new in your day, right? So lots of different training modules, but it begins to then sort of branch out where there's more ability for the individual to say, "Ooh, I want to look at this training. Oh, this is something I'm really interested in." Now, the other key piece, and this is both for our in-person and our online assessment, is we don't just leave you alone with this information. So you do have access either to an in-person clinician like myself if you're doing this in-person assessment, or if you're involved online, you have the opportunity to have a coaching session. It's just like a virtual, like a little Zoom call, right? A coaching session where that coach has access to your assessments, can see what you've been doing in terms of training, and you guys can kind of talk, brainstorm like, okay, I've been trying this. What do you think about that? To your point about multitasking, we get a lot of questions where people are like, okay, what do you mean by multitasking? Let me give you an example of what I'm doing, right? Or we have this idea of really making sure that you're using your brain in like stretching your brain every day. You're using problem solving. You're really giving yourself time to kind of have concentrated thought every day, and we call them elephants, your elephant tasks. Well, I'll have a lot of conversations with people who are like, what are these elephant tasks? What do I do with them, right? It's a great opportunity to hash these things out and to make it very personalized for folks. So then the key, I think, is routine assessment. So that folks have the opportunity to take a new assessment every 6 months, right, to be able to gauge themselves. And this isn't about, oh, how much have I gotten better or am I going to pass this time? This is about, am I maintaining my brain health over time?
That's right. And so this evaluation, that's the brain health index. So you take that at a certain cadence in those intervals between you're working through these modules.
Yes.
Maybe on your own or with a coach. Yeah. And so the index is where you're really able to see the improvement.
Yes.
Do you or have y'all ever used any sort of, just curious, like any sort of imaging to sort of corroborate maybe what you're finding from the index? Are there any types of fMRIs or any sort of imaging that can shed light on the fact that there is maybe possible cognitive improvement that's happening?
So one exciting part of our history here at the Center for Brain Health is that we now have the opportunity to have 2 MRIs on our campus, which is very exciting. And so as part of a longitudinal study called the Brain Health Project,
Yes.
we have been able to take a small group of folks and take them through fMRI imaging, right? So they have been doing this small cohort. In addition to the assessment online that we've been talking about and the training and the coaching, they also have been coming in every 6 months to a year to get fMRI imaging. And one of the really exciting things that we've been finding as we look at this imaging is not only are we seeing improvements in the Brain Health Index, so through those assessments, we're also seeing functional improvements as we look at the fMRI data. One of the things that we see is something called hemodynamic response. So the idea that the brain is recruiting blood where and when it needs it. And one hallmark of healthy brain function is that the brain is recruiting this blood flow just in time. So this just-in-time recruitment of brain blood flow is a hallmark of brain health that we can now track.
That's fascinating.
And so we see these connections between improvements in someone's brain health index and improvements in their hemodynamic response.
Okay. So I'm going to play with some terms here. Is this considered neuroplasticity? Is that what we're talking about?
It absolutely is. So we would define neuroplasticity as the brain's ability to change based on how someone uses it. And this is exactly an example of neuroplasticity. In fact, I'll say, just going back, even when I was in graduate school, when the brain was discussed, it was discussed in a very static way. When assessments were discussed, it was discussed in a very static way. So you take an IQ test once, and that's your IQ for the rest of your life, right? So what we now understand is that the brain is constantly changing and responding to whatever stimuli it's being provided. Now, that can be a positive thing, and that also can actually become a challenge or a problematic thing. And so with that, we want to harness neuroplasticity, and something like looking at improvements or changes in hemodynamic response is another hallmark of looking at neuroplasticity. The brain is changing.
Okay. Yeah. So I take it, so you've looked at, you probably have so many brains you guys have looked at over the years.
We have a lot of brains that we looked at.
You probably have more brains that you've looked at than anybody. But when you look at this, have you started to kind of dial into some key areas? For instance, as you know, Enterhealth, we're in the space of addiction and mental health. In addiction, mental health goes hand in hand because, as you know, being an LPC, there's the dual disorder component to addiction. So there's more often than not something else going on underneath. Anxiety, depression, could be some learning issues, but there's usually an emotional issue. I don't know if it's the chicken or the egg. We can debate that for a long time, but all of our patients suffer from that.
Yeah.
And so when you look at the community that we serve, have y'all in the Center for Brain Health done any research in and around this area?
So we've done a number of different studies, smaller studies, that have looked at how can we help support folks with, let's say, an identified mental health condition and provide them key cognitive tools to help support their brain health. And an example that comes to mind is a colleague of mine who worked with folks who have been given a diagnosis of bipolar disorder. Now, these are folks that we worked with a number of mental health professionals outside of the Center for Brain Health to identify key folks who were, stabilized and under mental health treatment.
Okay.
And then in addition to that, we provided them these cognitive tools, right, and assessments as well. And what we saw was that they benefited from these cognitive tools, right, because these cognitive tools, we posit, these cognitive tools are universal. Right? So they're universal and accessible to most of us when stable, right?
Yes.
When able to consider strategies and having a strategy-based approach to information. So we've worked quite a bit with that group. Another group that is similar, I think, to we could kind of talk about this a bit as well, is individuals who have attention deficit hyperactivity disorder.
Yep.
And that's a key group that really benefit from being provided some strategy-based training to help support their ability to focus on what's important.
Yes.
And what we saw with both of those groups, too, was this secondary improvement in their mood, right? So if I feel like I'm more in control, right, I feel like I have more agency over my day, and I'm probably going to feel a little bit better about myself. I'm probably going to feel a little bit less stressed, right? So those are two key groups. Another group that I think is really interesting and I know there's some crossover here, is folks who've had a concussion or traumatic brain injury, right? And so, again, going back in my more traditional background, I have heard, and I'm sure it's come out of my mouth, unfortunately, back in the day, professionals say after X period of time of recovery, that's it. In terms of your recovery from a traumatic brain injury or concussion, I've heard 2 years, I've heard 5 years. The unfortunate thing, I think, what that becomes then is that folks feel very disempowered, right? So working with folks who have that very complex combination of, it's cognitive issues, it's mood regulation issues, sometimes it's physical issues, et cetera, helping them understand that regardless of where they are, that there are opportunities to improve through these practical training techniques has been, it's just been a joy.
Oh, I can imagine.
Been a joy.
Well, Center for Brain Health has been around, like you said, 25 years. It has a great reputation in the community. The thing I love about Center for Brain Health is it was born in this community.
Yeah, that's right.
And it was formed in Dallas.
Yeah.
And, Enterhealth was formed in DFW as well. Yeah. Feel like we were built really for the community. Mm-hmm. And we're in a similar space. We don't do the same thing, but we share a lot of, I think, similar ethos in terms of what we're looking at. We're helping people with substance abuse and mental health issues, but the core organ, if you will, that we're really looking at is the functioning of the brain.
Absolutely.
And so one of the opportunities that we feel like, to collaborate with the Center for Brain Health is integrating in some of your index, your brain health index. It's really kind of a measurement tool in the regard of how we might use it. And apply it in a fashion where we're evaluating our patients that are going through courses of treatment. So at a certain cadence, and this is kind of what we're working together on right now, is at what cadence and intervals do you do the Center for Brain Health Brain Index on our patients? And as they go through a course of treatment, our hope is that this could be a great outcome tool to be able to demonstrate that if you do treatment in the following manner, you can actually improve cognitive functioning, not based on what we think, but actually based on a reputable organization and the tools that they use. And as we've discussed, in the field of addiction, outcomes measurements they're all over the place. It's really, really difficult for people to stake a claim in and say, we have a success rate of X. So I'm really intrigued by kind of moving into this endeavor with you all to see what we find. I'm very hopeful that what we're going to find is that cognitive enhancement actually, it's improving. Because as you know, so much of what we do have tools. We do use a very personalized form of neuromodulation called MERT. Big part of our treatment is going to revolve around lifestyle management, nutrition. We're going to talk a little bit here in just a minute on functional psychiatry and how that world comes together. But as we look at working together on this, do you kind of feel like the Brain Health Index is going to end up being an interesting outcome measurement tool for the field of addiction?
It's something that, when we connected initially and explored possibilities to get to collaborate together, it's something that really excited me, both as a cognitive neuroscientist and also as a licensed professional counselor, because I can both see from an outcome measurement standpoint, lots of really wonderful ways that we can chart healing, right? And then also on a very personal kind of patient-to-patient level, what it can do in adding a sense of empowerment, personal empowerment at a really critical time in someone's health journey, right, as they're recovering from addiction. I think being able to provide them these, like, hey, look, this is the standardized measurement, and look at all the hard work that you've done over this last 30, 45 days, whatever it may be, and here's some tangible results.
That's right?
And I think I can imagine, someone coming through that process and thinking, okay, there's hope. Here's another piece that I can hold on to as I go further into my recovery.
That's right. That's right. And I feel like that's one of the key things. Like with Dr. Latif, who's our chief medical officer, we were having a discussion on this subject and bringing functional psychiatry into what we do. It's not a silver bullet, but it's another really, really important tool that I feel like gives patients and families hope around, can my loved one get better? Yes. It's a field that, for lack of a better way to say it, is really probably underperformed over the years. And I feel like having a healthy sense of curiosity and what could be is really important in our space that we serve. So kind of jumping into a little bit of that, since I'm bringing functional psychiatry up, it's, as a layperson, it's really the idea, the fact that the head is connected to the body, and what goes on biochemically in your unique biochemistry actually affects the symptoms that you are feeling from a mental health standpoint. And so I had done a podcast with Dr. Latif, and we talked about this, that the area of psychiatry, I feel like it's on the move in a good way, in the sense that it's evolving from just treating symptoms, but actually starting to look at things as, what's the root cause of the symptoms? And he does a really nice job in this interview of laying out how you build the foundational building blocks of repairing your unique biochemistry, genetics, could be hormonal related. All of these things come together, and if you treat them properly, they actually affect your symptoms, and then can use traditional Western medicine. You maximize it. You get more out of it. So as we had discussed a couple of meetings ago, as we bring that world into our treatment system, how does the Center for Brain Health look at similar things? Like, I know you work in the lifestyle medicine area. How do you feel like that impacts brain health and improved cognition?
Well, I think what it does, it's so well aligned with our multidimensional view of the brain and of brain health, because one thing that I think is so critical in any of this discussion is, are we connecting with the folks that we're working with and providing them meaningful and actionable recommendations that they know, they leave our office, our facility, whatever, and they feel that they really have the next steps. And so, there's some common language in terms of, let's say, like nutrition, gut health, sleep, right? Things like that are so critical, but making those things both personalized and actionable for folks, I think it's so important to supporting their health. So one thing that we've done at the center is we now have a board-certified lifestyle medicine physician, Dr. Jane Wigginton, on staff, who also can provide some guidance to folks who are coming through, particularly through our in-person assessments, who can look at, pretty detailed health history, look at medications, consider possible interactions, right? Help them think through questions they might want to ask their medical provider about, oh gosh, you're on this medication. Gosh, let's look at these side effects and just kind of see if this is something we'd want to explore a little bit more. I think it's so vital to help people understand that, it is not that these things don't happen in silos.
That's right.
Right?
That's
so
right.
the medication that you're prescribed from your primary care is actually going to probably interact with the medication you're prescribed from your psychiatrist.
That's exactly right.
And if you eat junk food every day or you have caffeine all the time, all of these things. So I think it helps connect the dots for our clients and patients that can make such a huge difference as they move forward.
I completely agree. Again, Dr. Latif and I were talking about this. I feel like one of the issues we have just in our healthcare system in general is that it's very narrow, and the different disciplines really don't interact a lot with each other. And it feels like it's turned into a lot of specialties that are focused on process and protocol. And you're moving so quickly through patient care that it's really, you miss the critical thinking part. A lot of what you test for, the novelty, what could be, the creativity, what are we missing? How do I take my knowledge in this subject matter and apply it over here? I feel like in healthcare, there's a real opportunity there because, yes, you're a psychiatrist and you're trained in the area of mental mood disorders, but the brain's connected to the body. And if you don't have a good core understanding of how the body interrelates with the brain and what else might be going on that could be exacerbating or corroborating the symptoms that you're seeing, you're missing important pieces to the puzzle. But I keep thinking, well, why is that? I think our system is set up where it incentivizes that. You've got different disciplines, different specialties, the payer system is set up to, reimburse a certain way. But I think we're missing something in the care for individuals by doing it that way. And so one of the efforts that we have at, in Enterhealth right now is to try to bring these multi-disciplines together. The best of psychiatry, the best of functional medicine, the best of neuropsychology, the best of neurology, bring it together and, corroborating with a great institution like the Center for Brain Health. How can we bring all the tools to bear to help patients get better?
I think it is so critical, and I think a piece of it, and I do think that this is shifting. I truly do. I think both from a practitioner side and from a patient side, there is this greater understanding that we have got to start talking to each other.
That's right.
Right. We've got to be more, I think from a patient side standpoint, be more proactive and empowered to ask questions and to make those connections. And then also from a provider standpoint, I see more and more of that, which is really hopeful to me because I completely agree. I think we've got to move outside of these silos. And a piece of it is understanding the value of that, like what that does for patient care.
That's exactly right.
I mean, that's the piece that we all need to.
Well, that's why I'm excited to have a chance to work with you guys, because I feel like you might be a little bit of the Trojan horse in helping to get out that the things we're trying to do actually work, not just us saying it, but actually on the back of a great health index that's very proprietary and been built over time. We can show improvement in brain function.
Yes.
Other types of tests and outcomes will show overall health as well. Bring those worlds together, and hopefully we can really make a dent on the outcomes in this field.
It's exciting.
Okay, so as we kind of come to a close here, give me a feel for where the Center for Brain Health is looking. What are some things that are out on the horizon for you guys? What are the areas you feel like you really want to pay attention to? Any advancements you're seeing that, hey, we're not quite there yet, but these are things we want to really look more into? What's out there? Where are you guys heading?
It's such an exciting time to be in this field and to be a part of a center that is now both nationally and internationally recognized as a key place to look at brain health. So a couple of things that I think that were really exciting is what will be driving us forward in our imaging, right? So because of the Brain Health Project, which is a 10-year-long study, we're 5 years in, so we've got 5 more years. Because of the data that we'll be deriving, particularly from those folks who've been in our imaging cohort, I'm very excited to see how we can then turn around that data to have more precision brain health, right? So that we're able to really see, okay, in real time what's happening, and then what can we do to help support someone's brain health from a very precise standpoint. So that's something that I think is really exciting. The other piece that we are working with one of our team members, Dr. Andrew Kniffen, to look at brainomics. So not only from a kind of a more clinical standpoint, but also from a strategy and more kind of working within bigger entities to appreciate what we can do economically when we attend to individuals' brain health. Right. Okay. So the impact, the brain drain that can happen, as well as the brain boost that can happen. So that's definitely on the horizon. From my work, one thing that's really exciting is being able to use and collaborate with other folks around the world, looking at their newer technology and seeing how we can look at other markers for brain health. And one example that I get really excited about is a group called Neuroscouting. They call themselves that because they've started working with Major League Baseball players. And their whole idea is using this small device. It just fits in your ear, just like a little earbud, right? And what it does is monitor heart rate variability, which most of us are familiar with, right? But it also looks at brain activity. And in real time, it's providing, like biofeedback, it's providing feedback to the individual, but it's also gauging how their brain can help better regulate in an active, conscious way, better regulate their nervous system between that balance of their parasympathetic and their sympathetic nervous system. So something I'm really excited about is being able to add that to my assessment battery as another way to empower the folks that I work with.
That's an interesting little advancement there. Because as you know, in our space, neurobiofeedback, things like that are pretty important. Yeah. That could be a good tool in the addiction and mental health space.
Oh, 100%. Again, it's just another way to help empower folks to better understand how they can use their brain, right? And this is the kind of thing that we can use regularly. It's non-invasive. It's 15, 20 minutes. It's really a wonderful tool, as opposed to something like, for example, fMRI, a wonderful tool, takes a lot more, right? So we want to have all of those tools in our toolbox. Expand, not contract.
That's right.
Right,
That's
our
right.
tools.
Okay, on the Brain Health Project,
yes.
How are you recruiting individuals into this? How do they get – are you looking for people to be involved in it?
So we will be actively recruiting until the project ends, right? So in 2030 or so, depending on who you ask, because some of us want to continue to extend this project, right? Because we're gathering so much. So we are actively recruiting. You can go through our Brain Health Project website, thebrainhealthproject.org. We're open to any healthy adults, ages 18 plus. Our oldest active participant, I think, is 93. So that's pretty exciting.
Very neat.
Yeah.
Very neat. Well, I have to tell you, this has been an absolute pleasure to spend some time with you. I really appreciate the relationship that we have with you and your organization. And I look forward to going on this journey with you and seeing what comes of it as we start to work more together.
Yeah. Well, thank you so much for having me. It's been a real pleasure. Yeah. Appreciate it.
You're very welcome.